Are you dealing with a share of back pain in your lower back or leg? Well, if you are, it could be sciatica, a nerve issue that's very common. We want to toss things over to health reporter Haley Hernandez to talk about what you can do if you're experiencing this morning. Good morning, Haley.
Good morning. Yeah, so I'm over here now, and joining me is Dr. Ravi from the Clear Lake Clinic of Kelsey-Seybold. You are an internal medicine and orthopedic specialist, correct?
That's correct, yes.
So we are going to talk about sciatica because I know that's a pretty common condition, right?
Very common, unfortunately.
How do people get sciatica?
Well, most of the time it's usually people that are considered to be overweight or obese. Sometimes it's more commonly seen in smokers, but can also occur even in people that have a lot of physical labor or as part of their occupation. Sometimes we even see it in people that have a lot of time sitting on the desk, not really exercising, so that could be a contributing factor.
Like that sedentary lifestyle is what we're talking about?
Correct.
People who typically sit for probably like 8 hours a day at a desk.
Correct, yeah.
And what does the pain feel like? Like, how would you know you have it?
Most of the time it's usually on the back of the thigh, shooting down towards the leg, and in certain cases can even get down to the feet. But it's really following the trajectory of the sciatic nerve, which is one of the biggest nerves in our body.
And is the shooting pain what indicates that it's probably sciatica and not something else?
Correct.
Mm-hmm. And what should somebody do if they think that they have this? Who should they talk to?
Well, 75% of the time these do get better on their own, so we do tend to watch it. It depends on really where it comes from and what the cause is. But if it is starting to bother them, usually we do have them contact their primary care physician or their doctor's office.
I didn't actually know that it was something that could get better on its own, because it can also progress so badly that somebody could need surgery or something for it. Isn't that right? Correct,
depending on where the cause is, and usually it can come from either the spine or outside the spine. And so that's something that we will have to investigate and look into.
I mean, I've heard of people having sciatica, and it's really a debilitating pain. Like, they really feel like, I mean, walking hurts, standing up hurts. Is that true for most patients?
For most of the time, yes. And then sometimes if they really feel the need to contact us, we can help guide them and triage them if they need higher level of care. But usually we have them contact us first to go from there.
So we talked about what causes it. So therefore, is there a way to prevent sciatica?
Yes, usually it comes down to strengthening the core, sometimes the lower back muscles, and also the lower leg muscles to help minimize the risk of it flaring up in the future. Really, sciatica comes down to inflammation of the nerve. So how do we prevent inflammation of the nerve? We have to strengthen the structures that surround the nerve. That includes the muscles, the tissues. So daily stretches, warming up, cooling down, these are very helpful to minimize the risk of it happening in the future.
Interesting. I'm hearing a lot about stretching lately.
Yes.
People have dismissed that for too long, I guess, right?
Unfortunately, yeah. We're trying to reintroduce that because it's very, very helpful. Sometimes if patients even come to see me in the clinic, we do recommend physical therapy as an option to help show them stuff that they can do at home as well.
Yeah, and is the strengthening important in the core area? That's typically what you're looking to strengthen?
Yes, core and also the lower back. So we really want to make sure the whole section is very, very strong and is stabilized, and that's really how we can minimize risk.
Yeah, the whole trunk needs to be strong. And then one more time, what are the treatments for this condition if somebody does have it?
So if it's short term, we try to avoid imaging first off, and we base it off of the diagnosis in the clinic. Usually we do medications. There are certain anti-inflammatories that are good in the short term. A couple of the medications that have been extensively studied are diclofenac and meloxicam. These are very well-known prescriptive anti-inflammatories for the short term, meaning 5 to 7 days. Physical therapy, like we mentioned, stretches. Sometimes you can use a heating pad over the counter if you really want to before you go to bed. Sometimes I tell them to also take a warm shower at night to help warm up some of those muscles.
Yeah, and I've heard from people that anti-inflammatory diets have helped their back pain too. Do you recommend that as well?
Strongly, yes.
Yeah, great. Dr. Ravi, always great to talk to you. You always have good insight. Thank you so much for driving up from Clear Lake today. I appreciate it.
No problem.
That's my hometown. Zach?
A little shout out. A lot of good information. Thank you both.